a heads up on the gram-negative lab algorithm. We've done the diplococci. When we talk about gram-negative, we either have the diplococci, the coccobacilli, or the curved rods. The diplococci includes the aerobic organisms. When we perform the maltose acid detection, if it's negative, we know it's either Neisseria gonorrhea or Moraxella. And if it's positive, we know it's Neisseria meningitis because Neisseria meningitis uses glucose and maltose, but the Neisseria gonorrhea does not use maltose, and Moraxella uses neither. Then we move on to Coxibacilli. We saw the Haemophilus influenza, Bordetella pertussis, the whooping cough, Pasteurella, Brucella. Brucella was the animal-loving favorite one. The Francisella tularensis we haven't seen. We'll see it later. And Acinetobacter baumannii we've also seen, right? So after these Coxobacilli, we move on to the bacilli. Now, when we talk about the bacilli, we said we talk about lactose fermentation. Now, when we talk about the non-lactose fermenters, we do this oxidase test, and if the oxidase test is negative, if it's positive, we know it's Pseudomonas. If it's negative, we perform the H2S production on the triple sugar iron agar, right? So the Salmonella and Proteus basically give you these black colonies because they produce hydrogen sulfide. The hydrogen sulfide reacts with iron to give you the black iron sulfide. So Salmonella basically gives you these black colonies, and Proteus also gives you these black colonies. Salmonella and Proteus are they're both motile, and Salmonella causes your typhoid gastroenteritis, and Proteus causes your UTIs and Stewart stones. On the other hand, the negative H2S protection on TSI agar was basically Shigella and Yersinia. Because Shigella is non-motile, it does not produce the hydrogen sulfide, which can react with iron to give you black colonies, and hence it does not produce the H2S. Also, Yersinia enterocolytica, it's H2S negative. It looks like a bipolar safety pin staining. It causes enterocolitis and mesenteric adenitis, which is also known as appendicitis. I'll show it to you, right? So let's go on to the Yersinia and Proteus. When we talk about Yersinia and Proteus, basically, here we go. Let's talk about these non-lactose fermenters, right? So they're oxidase negative, and the Proteus basically produces the H2S gas on the triple sugar iron agar, but the Yersinia does not, right? Yersinia, like Shigella, does not. Proteus, like Salmonella, does. Now, Yersinia, we have two organisms when we talk about Yersinia, right? We have the Yersinia enterocolitica, which causes the enterocolitis or pseudoappendicitis, and we have the Yersinia pestis, which basically causes the plague. Now, both of these are gram-negative. They're facultative anaerobes. They do not use oxygen, which is why they were oxidase negative. And they're facultative intracellular pathogens and members of Enterobacteriaceae, right? So, Yersinia enterocolitica, this is basically gut attacking Yersinia. So, the reservoir in which Yersinia enterocolitica is present is dogs, pork, which is most important, and contaminated water, right? So Yersinia basically, it's the special feature about Yersinia is it basically grows at 4 degrees Celsius. So most bacteria hate refrigerators, but Yersinia loves the refrigerator. It says cold, no problem. It loves it, right? It can multiply in refrigerated food. This is basically called psychotrophic growth. So whenever you have this cold enrichment culture, you can think about Yersinia. It creates these bullseye. Do you see these bullseye colonies? It creates these bullseye colonies on CIN agar, right? Um, CIN agar is basically a cephalocidin, ergasin, novobicin agar. It's a specialized selective differential culture medium in microbiology used to differentiate and isolate and identify Yersinia bacteria. So it basically Yersinia creates these bull's-eye colonies which have this dark center and pale surrounding ring on the CIN agar, right? It looks like a bullseye, so that's something to remember. The pathogenesis of Yersinia is such that it reaches the terminal ileum after ingestion. Basically, it reaches the terminal ileum, invades the M cells of fire patches. So this also invades the M cells of fire patches, and it enters the lymphoid tissue there and causes inflammation of mesenteric lymph nodes. So what's special about this? It goes into the mesenteric lymph nodes, right? Which is why it causes this enteritis and mesenteric lymphadenitis. Enterocolitis, basically, when we talk about enterocolitis, we talk about um, fever, diarrhea, bloody stool, abdominal cramps, right? So it can cause acute bloody diarrhea, pseudoappendicitis, which is basically right lower abdominal pain due to mesenteric adenitis or terminal ileitis. This is a reactive arthritis in adults. Mesenteric lymphadenitis, this is the classic one. The inflamed lymph nodes near the ileocecal region mimic appendicitis, right? So it is the inflamed lymph nodes which are near the ileocecal junction. The pain mimics the pain of the appendicitis. The patient presents with right lower quadrant pain, fever, tenderness. This looks exactly like acute appendicitis, but appendix is normal. This is why we call it pseudo-appendicitis. Why do we call it pseudo-appendicitis? Because this right lower abdominal pain due to mesenteric adenitis or terminal ileitis mimics the pain of appendicitis, right? It's just like the pain of appendicitis. And reactive arthritis in adults, this is weeks after the diarrhea. The adults get knee pain, ankle pain, joint swelling, and the immune system keeps reacting after infection. That's um, all about Yersinia. If we talk about the famous sibling of Yersinia, it also causes plague. This is the famous plague, Yersinia pestis. The reservoir is rats and rodents. The vector is a flea, specifically the rat flea. The transmission cycle goes like the rat is infected, the flea bites the rat, and the flea acquires the Yersinia pestis, and then the flea bites the human, and the human is infected. There's a special lab feature. The Yersinia pestis basically has this bipolar staining where the dye accumulates at both ends, so it looks like a safety pin. This is one of the most tested facts about Yersinia pestis, which causes the plague. It has this F1 capsule, which is antiphagocytic, so it prevents the neutrophils from eating it. It has a type 3 secretion system, which injects its toxin proteins into host cells, which basically blocks phagocytosis. It blocks the cytokines and it suppresses immunity. The bubonic plague was basically the famous bubonic plague was caused by the Yersinia pestis, right? So after the flea bite, it goes into the skin, into the lymphatics and the lymph node. The node becomes a bubo. A bubo is a large, painful, swollen lymph nodes. It's usually found in the groin, axilla, or the neck, and it causes fever, chills, and painful lymph nodes. That's your basically plague. It will come back to Yersinia pestis later, but that's enough for now. We move on to our Proteus then. Think of Proteus. When we talk about Proteus, think of Proteus as the bacterium. It swarms, it splits the urea, it makes kidney stones, and it loves urinary catheters. So if Yersinia is the appendicitis mimicker, then Proteus is the stone-forming swarmer, right? Proteus species are basically gram-negative rods. They're motile, they're facultative anaerobes, and they're members of the Enterobacteriaceae, right? When we call something the members of the Enterobacteriaceae, what do we mean basically? Enterobacteriaceae is this large family of gram-negative bacteria. It includes over 30 genera and more than 100 species. Its classification of the level of family is still a subject of debate, but one classification places it on the order of Enterobacterales of the class Gamma Proteobacteria in the phylum Pseudomonadota. That's not important for you. But what you want to know about this Enterobacteriaceae, when I say something is part of the Enterobacteriaceae, it's basically referred to enterobacteria or enteric bacteria, as several members of this Enterobacteriaceae live in the intestines of animals. In fact, the etymology of the family is Enterobacterium with the suffix to designate a family Aceae, not after the genus, but basically what we're trying to say when we talk about Enterobacteriaceae is that along with many harmless symbionts, these harmful pathogens also and harmless symbionts also, more familiar pathogens such as Salmonella, E. coli, Klebsiella, Shigella, all of these disease-causing bacteria in the family include Enterobacter, Citrobacter. Members of these can be trivially referred to as the enteric bacteria because most of these live in the intestines of animals, right? So Proteus is also one of them. And Shigella, Salmonella, Yersinia, these were all Enterobacteriaceae, right? Now, when we talk about the classification, we the two most important species of Proteus is Proteus mirabilis and Proteus vulgaris. The mirabilis is even more common than vulgaris, right? I'll just punch it down here. Why is it called Proteus? Proteus is, you can see here, it's a shape-changing sea god in Greek mythology. Because on agar plates, the bacteria seems to change form and spread everywhere because they have this special swarming motility. And the swarming motility is basically their first virulence factor. The Proteus has this flagella, which is called the peritrichous flagella. This is flagella all around the bacterium. So basically makes it very, very motile, right? It has this special swarming motility. So on agar, instead of forming a neat colony, it spreads outwards in these concentric circles because of its swarming motility. And exam pearl includes the fact that this swarming motility on blood agar is always a proteus, right? The second valence factor is that it has a urease. Since it has a urease, the urease breaks the urea into ammonia and carbon dioxide. The ammonia makes the urine alkaline. Why is alkaline urine bad? Normally, the urine is acidic, but when protease raises the pH and makes the urine alkaline, it basically, the minerals in the urine basically precipitate and form stones. So you get these formation of struvite stones. Can you see the struvite stones? You get these special formations of struvite stones. And this is basically why are they called struvite stones? I'll show it to you. They're basically also known as staghorn calculi. Why do struvite stones look like staghorn calculi? I'll show these to you. So when they form in the kidney pelvises, they form these staghorn type calculi. Can you see this one here and this one here? I'm going to show you another one. So if I remove this calculi, this is how it looks. It looks like a staghorn. Okay, that's why we call these two white stones staghorn calculi. Right? They can become huge. They fill the entire renal pelvis. A catheterized patient, you will get it vignette like a catheterized patient develops recurrent UTI. His urine is alkaline. There's a large kidney stone. And your answer is Proteus mirabilis. Why do two-white stones look like this? They become huge. They look like these staghorns. Another variance factor is adhesion. So Proteus has fimbriae that help to attach to urinary epithelium, attach to catheters, and they resist flushing by urine. Okay, so diseases caused by protease include the UTI in catheterized patients. The catheterized patients, elderly and hospitalized patients get UTIs. It's very, very common. Then pyelonephritis is very common because the infection ascends from the urethra to the bladder to the kidney. And then struvite stones are very common. Wound infections are very common. How do you diagnose it? It's a non-lactose fermenter. On mechanically, it shows pale colonies. And unlike E. coli, which causes pink colonies, or Klebsiella, which also causes pink colonies, on mechanically, this protease causes pale colonies. The urease test is obviously strongly urease positive. This is one of the strongest urease reactions among the Enterobacteriaceae. And I guess that's enough. That's enough. I'll stop here and continue on the next organisms in the next video.